can suffer from seasonal allergies. That's about 30% of our population. And I know a lot of you out there, you're dealing with the itchy eyes, throat, sneezing, coughing, runny nose. So what do you do besides run out and get a prescription? Well, Miriam Zari is here with some great ideas. You're an allergist, and I know that you've seen a lot of people coming in your office saying, help, what do I do? This isn't ending.
Right. So this season, it has been especially hard on some patients. We've had the heat that has hit San Diego a little bit earlier than it usually does. So the pollens have been sort of at the high levels earlier this year than the years before. So we have a lot of people who are suffering.
A lot of people are suffering. And then since our weather goes from chilly to warm, it's like they can't get a break.
There are a lot of different triggers for people who have rhinitis. So one of the triggers is heat, but the other trigger is the low humidity that we are dealing with right now.
Okay, so I feel so bad for you if you're out there and you're dealing with this. All right, let's talk about foods that can make your allergies worse. I never would have connected food and allergies, but apparently you're saying this is a very strong connection.
Right, so there is this cross reaction between foods and certain types of pollen. So they're in the same family. So for example, if you're allergic to ragweed, you're going to have trouble with watermelon and melons. So, or if you're allergic to birch and some of the trees, you're going to have trouble with some nuts, for example, almonds and apples. So, and for some people, that's a huge effect, and it can exacerbate their symptoms.
Okay, so you really need to know exactly what you're allergic to in order to cut ththose specific items out of your diet. Let's talk about things maybe you should add to your diet in order to get some relief.
Right, so I always go back to the basics. We always talk about food first, and Hippocrates, who was the ancient father of medicine 2,000 years ago, used to say, with the right food, medicine is of no need. With the wrong foods, medicine is of no use. So we go back to the foods and we talk about the bioflavonoids. So we talk about the broccolis, the red onions, the apples, the oranges. This is what gives you that quercetin that can be an mild antihistamine. Or you can also have things like the butterbur, which is a natural antihistamine that a lot of my patients use.
Right here, so this is something you can pick up at Sprouts or one of the health food stores.
You got it. So if you're into your foods, eat your foods. But if you're a pill person like my husband is, he has to have the pills.
He has to have the pills.
He has to have the pills.
So that's good to know. Butterbur, what is this one over here?
Butterbur is that one, and then you have quercetin, which is pretty much what you get when you're actually eating your 12 servings of fruits and vegetables a day.
Okay, now I wanted to clear up a couple myths when it comes to allergies. I was told that if you eat local honey, that'll help. True or false?
So that's false.
False?
So yeah, it's because if you think about it, a bee usually is picking on flowers, and they're very heavy grains. What people are oftentimes allergic to is these light grains of pollen that comes off of trees and grasses. So it's two different things, and that's a big myth.
That's a big myth. Okay, and then what about bee pollen supplements?
And again, there is a certain percent of the population actually can react to the bee pollen extracts. So it can actually cause anaphylaxis. So we don't really recommend it. It's not very useful.
Okay, it could be downright dangerous for some of you out there as well.
Very
All right,
true.
so nasal washes are one of the things you recommend.
Exactly. So one of the things you want to be able to do is to actually remove the pollen and the debris that's in your nasal passages. So it comes as easy as doing a wash with a bottle like this, or for the little kids, something like this, salt and water. You can get this at your local pharmacy or your grocery store.
For little, how little? Like is less than a year or two little?
You can start this as early as 1 month. So this is, you're not going to have allergies at that age. But remember, if you had the bulb suction with the little babies, you can easily do this in their nasal passages to remove mucus, but you can also use it to remove pollen.
Okay, very good to know. All right, now over here we're talking about a couple medications that are over the counter?
Correct.
Okay.
So the common treatment is usually an antihistamine. So the two antihistamines that are very effective that are over the counter, that are my staples in my office, is usually Allegra and Zyrtec.
Okay.
And now over this past 6 months, we also have a nasal steroid, which is our gold standard for treating nasal congestion and rhinitis. And you can get that over the counter without a prescription.
Now you can. This year you can finally do that. Okay. And when it comes to the kids, would you just recommend the simple, like, syrup or?
I would, usually children 6 and under are not comfortable taking pills, so it's usually the syrup is the way to go. But after age 6, usually once they learn how to swallow a pill, the pill is the way to go.
The way to go. Okay, and then some sunscreens there on the end. I know that that doesn't have exactly a lot to do with being allergic to stuff, but things to keep in mind for the summer season.
Correct. So there are a lot of people actually who can be potentially sensitive to sunscreen. And if you read the label, there are quite a few ingredients that are in your common sunscreen. So one natural way of going is usually with a blocking agent, titanium oxide and zinc oxide. So those two are just blocking agents, and they're very effective. But the other added plus is that it's safe for the ocean and the coral reef.
Oh, perfect.
So you want to be able to read the labels very quickly.
Awesome. And I did use one of those with the blocking agent, and I looked like a mime because it makes your skin and my son's skin completely white, but it did the job. So I guess no sunburn is a success for me.
And you weren't sensitive to it.
Right, right. All right, Dr. Zari, thank you so much for coming in. We do appreciate your expertise on this topic. And for those of you dealing with